A good afternoon to everyone. My name is Silke Hüper. I'm representing the Berlin office of the German-Ukrainian civil society platform Kiev Dialogue. And I welcome you all to our discussion. A special welcome, of course, goes to our remarkable speakers in Kiev and Berlin, Ms. Klympush-Tsintsadze, Mr. Nouripour, Ms. Tymoshevska, and also to Ms. Kosmehl, our moderator. I'm glad that we have you today, and I'm looking forward to your conversation on our topic. Is the pandemic tearing Ukraine and the European Union apart? Well, we hope not. But we believe it's worth drawing attention to this question. We are facing another wave of the pandemic now, and sadly, Ukraine is among the countries with the highest number of cases in Europe. And more than a year of the pandemic has shown that the virus affects not only individuals, but also societies, economies, governments, and international relations. We believe it's time to discuss how the pandemic could affect relations between the EU and Ukraine on the long run. Let me just point to a few aspects of our topic. What strategies could further support the integration and reduce side effects of the pandemic, such as travel bans? And how could new inequalities caused by different vaccination policies be avoided? We all know that Ukraine faces several serious challenges at once, the virus and the war. And we have seen a very tense situation recently with the deployment of Russian troops at the Ukrainian border. It is difficult to remain an optimist these days under these circumstances, but I do hope that our discussion today contributes to a positive outlook on the relations between the EU and Ukraine in times of the pandemic and beyond. The discussion will be moderated by Miriam Kosmehl, Senior Expert Eastern Europe and European Neighbourhood at the Bertelsmann Foundation in Berlin. I will get back to you in less than 60 minutes with questions from the audience. We will be happy to receive questions in the Zoom chat and also in the comment section below the Facebook live stream. And now I wish all of us an insightful discussion, and I pass the word to you, Miriam.
Many thanks, Silke. Can you all hear me? Perfect. COVID-19 is an experience we all share, and we're all trying to come to terms with the effects of the pandemic. But I believe we are all affected quite differently, depending on our location, our passport, or our job. When the pandemic hit, we were first all buffeted by the health damage. Then came the changes to the way we live, how we work, we study, we communicate, we travel. On top, the devastation to many economies, the upset to individuals. And as Silke pointed out in her welcoming, we also observe political effects on our societies, on international relations. Now, in the next hour and a half, this is what we want to assess, some of those effects on EU-Ukraine relations, but also on the underlying systems, politics and institutions, as well as on people's beliefs. Finally, we do want to take an outlook of what we'd like to see, what to aim at in the future, immediate and long term. We have three different thoughtful perspectives on these issues. Welcome, Mrs. Ivanna Klympush-Tsintsadze, Chairwoman of the Parliamentary Committee on Ukraine's Integration into the European Union. You are a member of the political party European Solidarity, and during the Poroshenko administration have been Deputy Prime Minister for EU and Euro-Atlantic integration of Ukraine. You've started your career in the NGO and think tank sector and have also worked as a foreign correspondent before in the United States and the Caucasus. Welcome, Omid Nouripour, foreign policy spokesman for the German Green Party's parliamentary group in the German Federal Parliament, the Bundestag. where you've been MP since 2006 and will be running again for the upcoming legislature in September. You chair the German-Ukrainian Parliamentary Group, and you divide your time when you're not in Ukraine between your constituency in Frankfurt in the German federal state of Hesse and Berlin. And I see this symbol, emblem of a soccer club that I'm afraid I'm not able to name. What is it called, Mr. Nouripour?
Eintracht Frankfurt.
Eintracht Frankfurt, thank you. So you're a soccer fan as well. Last but by no means least, welcome Victoria Tymoshevska, Director of the Public Health Program of the International Renaissance Foundation in Kiev, a part of the Open Society Foundations. Victoria, you are a medical doctor, an alumna of Columbia University's Department of Population and Family Health. You frequently publish on public health issues, and you have been following the COVID pandemic's public health effects closely since the pandemic hit. Now, this is how we're going to proceed. Victoria will first give us an oversight of the effects of the pandemic on Ukraine in terms of public health. Then Ivanna Klympush-Tsintsadze and Omid Nouripour will have a chance to comment. I'm going to direct some questions to them and engage the panel in a conversation. Silke Hüper will be looking into comments and questions from you in the chat function in this Zoom event and on Facebook. She'll bring them in as we go along. So Victoria, you will have the floor first. Please do lay out the health situation in Ukraine for us, and also inform us how have Ukraine's institutions and decision makers been coping?
Yes, thank you, Miriam. Thank you, dear panelists, for the opportunity to present and talk a little bit about the situation in Ukraine. With a population of 41 million, Ukraine has registered slightly over 2 million cumulative confirmed cases, and unfortunately, sadly, lost 43,000 lives due to COVID-19 since the beginning of the pandemic. Country is entering now what can hopefully be defined as the fading of the second wave of the pandemic. We currently have around 400,000 cases, active cases, but still 10 out of 24 oblasts in Kiev have over 60% occupancy rate of the intensive care units, which means that still the hospitalizations are quite high. They are reducing, but we see that more patients are being discharged, whereas in oblasts like Kharkiv, Khmelnytsky, and Dnipropetrovsk still suffer from high incidence rates and high mortality. This pandemic is characterized throughout its course during the year with a successful decision on early lockdown in March 2020, which clearly was one of the best decisions made, allowing us or buying us some time to prepare better as a state and institutions and hospitals to respond to growing threat. Second positive decision was immediate mobilization for the state COVID-19 response fund that gathered altogether an equivalent of $2.3 billion to respond to COVID pandemic. At the same time, I must say, with a deep sadness that we lost around almost 800 lives of health providers during this time. And part of it because not all of the funds were immediately used to procure personal protective equipment. Hospitals, despite the early lockdown, were not ready to see this inflow of patients, and family physicians on front lines and nurses were also ones among hard-hit groups that faced pandemic. So shall I right now share the slides, or maybe would it be helpful?
Yes, why don't you do that? Because I think it will be more easy to visualize some
Yes.
of the numbers you've been introducing us to.
All righty. So that's sort of the first outlook.
Of course, everybody can get the slides after the event as well.
Another peculiar element for the pandemic response was, unfortunately, what I have to say is inefficient and unbalanced use of the allocated funds to fight COVID. And we see from this slide that over half of the funds approved for COVID response were used by the State Agency of Automobile Roads of Ukraine for road reconstruction. And Ministry of Health was actually the second recipient for this support. Other expenditures, significant expenditures, went to the Ministry of Economic Development and Trade for the payments of unemployment, and Ministry of Social Policy of Ukraine, again for the payments and benefits for those who suffered and were affected by COVID, which shows us that only, roughly speaking, a quarter of funds from the total amount was used specifically to respond to COVID with regards to public health and health sector needs. We also seen that there were certain delays in terms of how the funds were decided to be used. For instance, one of the alarming late decision was the allocations to either upgrade or install the steady oxygen supplies in hospital. And we've seen that both during the first wave in November last year and in this April, we've seen patients who either were denied hospitalization or were hospitalized, but were requested to find means to ensure that they have oxygen supply. And we know that oxygen is not the golden solution to the COVID response, but it's a key element. Moving on, before I go to the third slide, I would want to say that both testing and vaccination are two important elements from the public health perspective, not from the medical perspective, on how we respond to pandemic. And with regards to testing, I must note that we, as a country, underutilized public and private sector clinics and laboratories. And unfortunately, when we entered the pandemic as a country, only half of our laboratory centers were equipped and prepared to ensure wide access to testing. And till today, private laboratories are not compensated for providing testing for COVID, meaning that such situation creates inequality in access to testing, because private laboratories, these are out-of-pocket payments, and patients or families who actually spend their money on what is otherwise should be guaranteed by the government. Moving on to vaccination, because now it's one of the hottest issue, is I have to say that Ukraine entered quite lately into negotiations on vaccine supplies, and we've seen several attempts of what I would call as a manual management of the procurement process that resulted in the situation where first European vaccination or countries were entering vaccinations. We as a country only started open discussion about how our negotiation process is going, what producers are being contacted for contracting, and what funds will be allocated to procure and secure enough stock of vaccines. Ukraine's national plan has an ambition of vaccinating slightly under 24 million citizens, which is comprising 70% of population over 18 years old. Therefore, it means that we need about 48 million doses of vaccines. As of today, Ukraine received a supply of 500,000 vaccines from Serum Institute of India, and around 200,000 from Sinovac Coronavac, as well as 117,000 doses of Pfizer through COVAX facility, and another 360, almost 70,000 vaccines, AstraZeneca Bioscience through COVAX facility. What does it mean? This is the total amount of these vaccines arrived in the country would cover either 1 million of people with their first vaccine or jab, and then we have only, unfortunately, 10 people who have, actually 8, 9, who have received both shots of vaccination. That means that even this amount will give us slightly under 500,000 people who would be fully vaccinated in the nearest few weeks. Also, we need to understand that COVAX as a facility has provided an incredible opportunity to secure some amount of vaccines, but indeed, objectively speaking, according to intermediate plan for the distribution, it will not cover the prospective 20% of the country's population, and therefore will not ensure the needed contribution to have that population immunity that we're all hoping for. As of today, almost 200 mobile teams across the country are providing access to vaccinations, who have been trained with the support of WHO and EU support here. We also opened up over 1,000 locations with the health facilities and family practice providers who will be administering next batches of vaccines. An average point allows to vaccinate around 50 to 60 people on a regular workday, and each vaccinated individual receives a vaccine certificate, and vaccination is registered with electronic medical record. A lot of discussions are now, and patients are inquiring about what does it mean in terms of the future electronic certificate, vaccination certificate, and their ability to prove their eligibility to be traveling, including, of course, European countries. I want to dive in into one more slide with regards to vaccination, which is a little bit concerning to me. And if we look and examine, and we will examine the structure of those who are vaccinated, and these are the freshest slides that, or fresh number that we have, we see that of the vaccinated cohort, we see that priority groups such as health providers and elderly people, meaning of those who are over 70, comprise, unfortunately, and slightly under 40% of all those who have been vaccinated. And surprisingly, we're seeing over a quarter of those who has been vaccinated actually do not belong to any priority group or category of population. Similarly, if we examine the age structure of those who are vaccinated, we know that individuals over 70 years comprise only 16.5% of the vaccinated cohort, while people aged between 20 to 40 years old, who again, not frequently belong to priority groups, such as health providers, social workers, or education sectors, represent 26% of those who vaccinated. These two findings are particularly alarming to me as a public health professional because they reveal that the national vaccination plan is missing its target among priority groups, and we're spreading thin our scarce vaccine stock. And therefore, this means that we definitely need to ensure that we follow through with regards to the priority groups as identified in the national plan. In parallel, we open up opportunities for people who are not necessarily in the priority group but want to vaccinate, and of course increase steady supply of vaccines, because Ukraine is currently fighting two communication myths or issues. One is the mistrust and disinformation on vaccines that is often rooted also from the country aggressor, and we see that a lot of disinformation come from their channels. On the other hand, we see this agitage raised by the fact that Ukraine's supply of vaccines is diminishing, and the small batches that we receive are definitely not satisfying the existing need and readiness for these vaccines. Lastly, I want to speak about the institutions and government response to the pandemic. And I must note that with the support of our EU partners and other donors, Ukraine has been able to establish strong, transparent, and accountable institutions such as National Health Service of Ukraine and State Enterprise Medical Procurements of Ukraine and Public Health Center of Ukraine. These three institutions were designed and are responsible for the effective response to pandemic. But their operations is overseen by the Ministry of Health. And unfortunately, I must say that we see that while Ministry of Health is supposed to better coordinate and increase effectiveness in relationship of these three agencies, we often observe decisions that are not always justified or cannot be explained by the epidemiological situation we're observing in Ukraine. We've seen that sometimes individual decisions override existing policies and procedures, and we've seen that resulting in delays of procurement and distribution of personal protective equipment, in expanding access to treatment, in expanding access to testing and vaccines right now. I strongly believe, and our partners strongly believe, that it's not about individual leadership and manual control and decision-making that is grounded in certain personal or professional interest or political interest should be driving the response to pandemic, but indeed the observation of policy following the transparent and responsible procedures should be the foundation for strong response to such challenging situation. We see that both National Health Service of Ukraine and particularly State Enterprise Medical Procurements are operating using the legislative framework and operational standards that are fully harmonized with respective EU legislation and directives, which in fact serve as fuses to prevent manual management by single individuals, whether at the level of the institution, or the Ministry of Health, or the Cabinet of Ministers. And therefore, along with a request to support Ukraine's negotiations and acquiring larger batches of vaccines and increase effectiveness in expanding our national vaccination plan, I would say that the role of these institutions is vital to successful respond to pandemic, to ensuring that priority groups get their vaccinations and also receive what is a future digital certificate for vaccination, which will open Europe and regain connection. Last small comment that I would add to this public health perspective, as I was preparing for this, I had several discussions with our counterparts, experts, and one of the non-public health related concern that was expressed is that through this 1 year of pandemic, there are a lot of partnerships that were unfortunately weakened by this pandemic, and there were a lot of partnership with Germany and other EU countries that never formed because how hard the pandemic hit the economic sector of Ukraine. So again, I would want to underline that this supposedly quite medical/public health problem actually impacted countries' economic situation and its relations with EU countries and Germany in particular. Thank you.
You muted me, yeah?
Can you hear me? Okay, sorry. Thank you very much, Victoria, for all your valuable insights. And I want to explain briefly to the audience that unfortunately, Mrs. Klympush-Tsintsadze cannot leave the parliament because she has to stay in the parliamentary hall in order to vote. This is why she is flexibly looking for a quiet space in Parliament and moving around and wearing a mask depending on the demands of the situation of where she is. Victoria, if I sum up what you said, it's an ambitious vaccination plan, a rollout of vaccination that leaves much to be desired, and a lack of vaccines. Above all, Mrs. Chairwoman, Ivana Klympush-Tsintsadze, if you look back at the past roughly 14 months, what do you have to add to Victoria's description that would help us to understand the political effects of the pandemic better? What are the ramifications in Ukraine and also for external relations? And also maybe as Victoria has described, society has so far been, again, robust in Ukraine, also in terms of self-help. But how far does this go? And who are the biggest, the most disadvantaged by the pandemic? People in insecure jobs, women, migrant workers. The floor is yours, Mrs. Klympush-Tsintsadze.
Dear Miriam, if I may, I will start answering in just 1 minute. Right now we have a minute between the votings, and I can leave, and then everybody will hear me very well. Maybe Omid can join in at this particular moment with his assessment, and so that you would hear me relatively in a quiet situation in a minute. Okay, I'm sorry. Thank you.
Yes, that's fine. So we'll hear you again after you voted, and I'll just turn to Omid Nouripour. Two questions. One issue that Victoria has been referring to is the challenge of inequality. Now, in Germany, we have been observing too that already going into the pandemic with inequalities makes existing ones higher. You know Ukraine well from a lot of contacts and visits. What can you tell us about how you perceive challenges of social justice, economic justice, now if we consider that inequality is even higher in Ukraine?
Thank you very much for having me, and I think Ivana is done. Maybe she want to take over again, and I'm very happy to, yeah, just because I think her comment on the situation in Ukraine is much more related to the great presentation Victoria just gave. Maybe I just wait a second and then take over. Whatever you say, you're the boss, Miriam.
Yes, I think that's a good idea. So we go to Ivana Klympush-Tsintsadze now. Ivana, you have the floor.
Thank you, and thank you for your flexibility. I also wanted to join in thanking Victoria, join you in thanking Victoria for her very balanced and very objective presentation. Unfortunately, as you understand, we are looking back over this 14 months. We have not witnessed the professional and highly qualified response from the Ukrainian authorities to challenge that the whole world is going through right now. And the numbers of the either testing or vaccination, unfortunately, are not impressive. And we are talking about end of April of 2021, and only 9 people in the whole 41 million Ukraine are vaccinated with 2 doses. That means that the consequences of the pandemic or the going through different stages of the pandemic, we are feeling them very, very seriously on all the society. And unfortunately, I think every Ukrainian citizen has seen pretty dire consequences of this inefficient use of allocated funds, even in the dire and difficult economic situation, and inability to organize the process that way that we, for example, as Ukrainian citizens would have access to, for example, baskets of the vaccines. We obviously are very variety of the vaccines. We are obviously very grateful to COVAX initiative and the ability to at least cover some of the need of the country, but definitely this is not the full response in how the situation can be and should be managed. Obviously, we should be relying also much more on our own resources and our own capabilities to react. So if we're talking about those who are most impacted, some of the things Victoria has already mentioned, the crippled system of the state public testing has led to the need of people going and paying their own money for testing. Obviously, when you have I have plenty of those examples when we see one family member getting sick and getting a positive test, then if others are feeling not very well, they are usually not going for testing. So that's another problem that I think was not that much pointed out to, that the statistics that we have and those numbers that we are operating with are not necessarily really reflecting the situation in Ukraine. So presumably, according to some of the assessments, analytical and mathematical formulas, assessments of the numbers could be much higher, both with the infected people and also with those, with the infected people. Also with those who are dying from the consequences of the COVID. That's not something that is being taken as a statistics here in Ukraine. So because if it's an active phase of COVID, that's one thing. If it's a consequence a couple of weeks or months later, that's not necessarily connected to this. So obviously all the people who are struggling after loss of their work in this economic situation or diminishing of the income, of the family income, they are among those who are impacted most severely. The state, the government has taken some of the actions in order to kind of give some financial support to those who either have had to go on leave, forced leave, or have lost their jobs. But obviously, this is not covering the needs of all the families. Also, if we are talking about those thousands and actually tens and even hundreds of thousands of different seasonal workers, or those people who have been traveling abroad for a short-term employment, they all have been called back to Ukraine back in spring of 2020, with promise from the state and the government that we will take care of you and will provide you with the opportunities, and we will create additional hundreds of thousands of new working places, which was not delivered. So people are looking for options and opportunities to actually restart their short-term contracts also abroad, also including in the EU countries, both unfortunately legally and illegally. And we also know that those who are working there illegally, they are definitely absolutely not protected with any neither contracts nor social benefits nor medical care and so on. So this is yet another risk group that is then going to be a burden if something happens, burden additional to their families and also to the state here, to the country that will have to take care of this. So therefore, I think that we've seen over this 14 months, we've seen something that has been already in the air earlier, but pandemic has been a litmus test for underlying this fragmentation and this, to an extent, national egoism that we are seeing right now. And obviously, yes, if we're thinking about any country, we understand that every country is protecting its citizens. And that's probably right? That's written in their constitutions, in our constitutions, that healthcare and security of your citizens is the main value. So, however, if we are thinking how the world will be developing further and how we will be supporting each other in the future, there, I think pandemic has outlined that we will have to think about additional coexistence and co-working and co-supporting mechanisms that are not necessarily yet there. And also, just one note that I'd like to finish this kind of intrusion. I think the ability to respond to this challenge in the national in different countries has been dependent on both social economic development and the resource base of the country, but also has been dependent very much on institutions that are working, that are efficient in any of the countries. And that's what we actually see, that both, governance institutions and the medical healthcare system that we have has we have been transforming it, but then it unfortunately the transformation and the whole reform has been kind of going back and forth, and we lost the time. So therefore, the medical healthcare system has not been ready to also kind of become a buffer to respond and to protect people.
Thank you. Ivana, one follow-up question to kind of lift this up a bit to the level of global governance. You very politely described how countries care for their nationals first. Other experts less politely speak about a global governance failure. Do you fear that the reputation of the European Union of Western governance systems has taken a hit because of the way this has been handled?
I think the answer is yes and no at the same time. Because yes, I think we all understand that if it wasn't for this national egoism, if it wasn't for the lack of and ability to flexibly and quickly respond, we could have managed to save maybe more lives and to actually preserve some of the positive economic tendencies that have been there across the world in different countries, but that has not happened. And yes, to an extent, it is a problem of everybody too much concentrated on themselves and not being able to kind of rise up to the need, to the global need, and look at the issue with all the depth and understanding that this needs a global response, and maybe some priorities that have been leading any of the particular countries have to be put aside for some time. That's also an option, but that's, I think, the option that has not been really exploited and explored by well, to an extent by Western countries who have the resources also to deliver more. But also, at the same time, some things have been done. And we have to also admit this and be grateful that, in our case, for example, in Ukraine, when we are looking at the piles of vaccines that Victoria was describing, basically it's only 117,000 Pfizer vaccines that we have from COVAX that are basically going to be guarantee for Ukrainians to use, for example, visa-free in the future, as we see that other vaccines are not registered in the EU, and the EU is right now trying to protect itself from travelers that are vaccinated by something else which is not registered in the EU. I think that's another negative and a bit negative effect of this governance, so to say, failure, as you were putting it, or some others have been putting it, not that much failure, but a little bit arrogance that is probably should be overcome, and that's our common task, to actually point this out, understand it, and then try to seek the solutions that would actually guarantee the inclusiveness of the world, and the because we cannot discuss inclusiveness of the different states and care about different minorities, but then not delivering on inclusivity of the global world. Something is really wrong with this approach.
Yeah, certainly not. Interesting. Finally, to you, Mr. Nouripour, and in addition to this inequality question that I posed, I would like you to think about this or the content of an open letter that has been sent by civil society organizations of all the Eastern Partnership countries, juxtaposing the level of progress in the European Union, which has jumped, actually, I'm talking about vaccinations here, from 5 to 16.5%, and contrasting this with the level in the Eastern Partnership states, which is 1% or less. And the signatories of that open letter also speak about the EU with its contracted supplies have more than twice the amount the EU actually needs, and therefore they ask for they plead for providing more vaccination doses to the Eastern Partnership countries. If you could also give us your opinion on that, please.
Thank you very much once again for having me, and thank you, Victoria, for your presentation. And it's great to see you again, Ivana. I think the office you are in has been the place we saw each other last time. Hope to be there soon again. I couldn't agree more with the content of the letter you just mentioned. Look, before we started this panel, Miriam asked me which are the countries I'm dealing with besides of Ukraine. And of course, one of the major ones in these days is India. Helping India is not because we are better people and we are soft-hearted, because we do not help. The new mutation of the virus is going to come in and then hurt us ourselves. A pandemic going to come to an end when it's fixed all across the globe. This is why they call it pandemic. And people and states and statesmen who do not understand that do not understand the character of a pandemic. So of course we have to help and we have to assist people of Ukraine because of friends. But if we are not doing it because of that, we have to do it because of our own sake. And this is the madness we see in these days, which is not happening. The hesitation of a lot of countries just being afraid of the bad headlines in their own newspapers is preventing them to help, and this is a huge mistake. The second level of a mistake is just let me describe it with a world famous presser of President Vučić given, I think, March 2020, when he kissed the Chinese flag and said that China is the only country on earth helping the Serbian people, and that European solidarity would be a myth. The reason for that was, I think, the delivery of 200,000 masks he got from China. What he just didn't mention was that we, as a European Union, of course, funded that selling, and that he could buy this mask. There are a bunch of little examples like that. Germany is paying. Not only Germany, European Union is paying for COVAX, which is the right thing to do. But when it comes to helping with vaccines, they say, hey, we are paying for COVAX. The result is that Latin American countries, for example, just go on buying Sputnik and then the Chinese vaccination, and nobody in these countries is caring who paid for that, because the Chinese and then the Russians propaganda coming in and saying we are saving the planet is of course related to the vaccination and then to the vaccines and to the doses they deliver, and then you can see the camera and not the money we gave. So just thinking that we just can give some money and then we can and we're gonna win geostrategy is a huge mistake. And the last one, and there are much of more dimension of that it could no, let's just go for 2 more points. The 4 last one is, of course, the question of economy. We are entangled, we are highly entangled, and then this is not only the European Union who's gonna need a recovery attempt after the pandemic. So it's of course about ourselves when we talk about how to help and how we can include countries of our neighborhood into the recovery also. So just talking about recovery in our own borders is a huge mistake, is harming ourselves also. And the last one, and this is not the most important one, but this is the one which is understandable when I look at the Ukraine the most, it's a question of social coherence. I just mentioned the propaganda of some kind of aggressive countries, and Ukraine is the front country when it comes to the hybrid warfare of Russia, which is of course targeting us also. Ukraine is the country which has been affected the most, not only by Russian military, and we are seeing it as in the escalation of the Russian side, and in Donbass and Crimea and the Black Sea and in Azov is unbearable. But of course, Ukraine has been the country which has been affected the most by fake news campaigns. And of course, these fake news campaigns are also addressing the question of how the pandemic is managed in our countries. And this is one more reason why we have to stand together, because this propaganda just going through the ceiling because we are not helping each other is a massive geostrategic defeat for all of us. And this is why we have to come together and help much more and support each other much more than we did, and just get rid of this momentums of nationalism we had in the beginning, which has been could be overcome in the European Union, but it's not enough, and we are not talking about it anymore. We created much more resilience in the European Union. We are doing much more than we did 30 months ago, but I think it could be more concrete, and it could be more outspoken, and it could be more based on dialogue. I know that there has been a lot of dialogue between Ukraine and the European Union. I think the 22nd EU-Ukraine summit took place physically, and it was not a worse idea. And then the Ukrainian diplomats are doing a lot for that. But this is not we are not giving the impression to the world, not that the Ukrainian side, but the European side is not giving the impression to the world that we are investing a lot into that, and we should change that definitely.
May I ask you a follow-up question, Mr. Nouripour? Where do you see a means for pushing international cooperation in such crises successfully? I listened to one expert mentioning in comparison the G20 and the 2008 financial crisis. And my second follow-up question, I was attentive when I heard serious thinker Ivan Krastev saying that he worried whether China and Russia had been coordinating their foreign policy also in their way of trying to use the pandemic to their advantage. And he was pointing to the timelines with Russia having this amassment of troops at the Ukrainian border and China pressuring Taiwan. If you could give us your perspective on these two issues as well, please.
Yeah, thank you. I would love to, but if I may, I would love to add one more point I just forgot to my talk before.
Sure.
When the Prime Minister of the proud state of Saxony travels to Moscow in these days, and he did last week, and announces that Germany is going to buy 30 million doses of Sputnik, in a moment when Russia still did not deliver all valid documents for get the license for Sputnik to the European Medicines Agency. We have a lot of homework to do then, still. And there are people who there is this crazy vaccination tourism now. I know people who ask me, should I travel to Cuba to get a vaccination? And there are people who go to Moscow, and the people in a lot of friends of mine in Moscow ask them, are you nuts? We do not take Sputnik until the European Medicines Agency is giving the license to them. Then we can believe that this vaccination is the right thing to do. And we know that both the countries Ivan wrote about, and you just mentioned, China and then Russia, told us a lot of things which at the end of the day were not that accurate when it came to their vaccination. I just can't remind anybody on the 84.7% of success rate of the Chinese vaccination. Today we know it's 50.4% of success rating, success rate of their vaccination. And yeah, what we are seeing in these days is some kind of a trend of aggressive acting of countries in the shadow of the pandemic because they think nobody cares. And this is what we cannot afford. It's of course the question of, this is not only Taiwan, and it's not only the question of Ukraine. There are a couple of others more. The way the Russian mercenaries were dealing with Libya for the last 12 months was definitely different than before. Just for one example, there are a couple of wars which definitely would not take place without a pandemic and without this lack of awareness. But the issue today, and the one which is the closest to us in Europe, of course, in the European Union, of course, this is what's going on in this eastern part of Ukraine. And this is why I think it's some kind of strange when the European leaders come together, discuss further sanctions, and just go out and say, well, we do not talk about sanctions until the Russians did not take the next measures. When they do, it's too late. So it's about now, not to go for the next level of sanctions, but to talk about them and announce what the price tag would be for the next level of the Russian aggression. And this is what they missed. And this has been a huge mistake, I think. And yes, the question of the platform, which is the right way to talk about all of these issues, when it comes to the medical care, of course, it's the WHO. And I fully agree with all of the people who said that the Chinese influence has been too big for the last years there. But the reason for that definitely was that the Western countries withdraw. And when the Americans go out, the Chinese come in, and this is what we see in all of the organization of the United Nations. But when we talk about the entire planet, we have to go through the bodies of the United Nations. When it comes to the economic recovery, it's of course different about the European union talking to its neighbors and then talk and try to help. And of course, G7 could have a completely other meaning in these days. And I'm to be, if I may end with that confession, I'm happy that I'm not happy with everything, which is what is coming from the White House, but I'm happy that there is someone there now, finally, who is caring for the rest of the world. So there are a couple of things we could do together.
And I hear from you a clear call for a more proactive foreign policy. Mrs. Klympush-Tsintsadze, I would like to give you a chance to comment and maybe also respond to the question that Mr. Nouripour has briefly touched, the issue of propaganda. And then I would like to bring in Victoria again. Victoria, you spoke about the challenge of trust hindering many people to actually get vaccinated in case it is possible with certain vaccinations. If you could pick it up there after Ivana speaks first. Thank you.
Thank you. Well, I'm really glad that there are such people in German politics as Omid, who is calling for a more proactive stance and for actually readiness to, again, to be flexible and having instruments at hand to at least to respond to the actions of such countries as Russian Federation. Because if the West was unprepared in 2014, even though we had Transnistria before, we had Russia attacking Georgia before in 2008, then in 2014, after first phase of attack on Ukraine, after illegal occupation of Crimea, those sanctions that have been imposed at that particular moment to the Russian Federation have been, and I've used this word before, have been really, really pitiful. And so it seemed that 7 years later, when we right now had this Russian buildup around the Ukrainian borders and this muscle flexing all over the world, and actually showing that Putin was showing that he doesn't really care of what the world thinks, we were happy to actually at some particular moment to see that there was more of a kind of coherent and consistent readiness to respond. There were some of the great and important political statements that have been immediately made. There was seemed to be to have been forming the proactive position, but then it kind of mounted exclusively to some sanctions of the United States and some steps forward as well by President Biden. I think, balancing this suggestion for dialogue and the stick kind of being shown. But I think it was pretty sad to watch how the ministers of foreign affairs of all the EU countries have gathered together, have listened to the Minister of Foreign Affairs of Ukraine, just knocked their head and said, well, we're very sorry that the way that the situation is developing the way it is. And that is not, actually that is, from my perspective, also hitting Europe and global projection of what European Union is, much more than, for example, this inability to get its act together with how you're going about helping others with COVID. I think so, because
and
that
Ivana,
also,
please,
yeah.
If we zoom in again on the situation in Ukraine, what is Russian propaganda there doing in this a particular situation? Do you feel a enforcement of old dividing lines, or what is your perception there?
You have to remember that that we are not the only ones who are being infected by Russian propaganda and who are being attacked by Russian propaganda. And it's even more important to understand that Ukraine, there is no I'm sorry to say, Berlin Wall between Ukraine and Europe, right? That would divide everybody from this intrusion of Russian propaganda. So it takes different ways, and it gets also through to European capitals and European societies, and that's why we have to fight this back together. The Russian propaganda is about everything. Russian propaganda, to an extent, is about anti-vaccination approach. And that has been mounting over years, over decades. It didn't start today. So here today, we're kind of we have the seeds of what has not already the plants of what has been seeded before. How Russia has been working with our society to ensure that people are not accepting vaccination as a normal kind of way of going and protecting health of your families. So it's not. So we have this type of propaganda coming in. We have also kind of heated emotions against spilling over to the society. And also we have to remember, we are unfortunately, as I said at the beginning, we are very much at this fragmentation state when when unities are being kind of broken, where books are being broken into tweets, where communication is being broken to TikToks and so on. So and where the social media, which is actually where Ukrainians at this particular moment are getting more than half of their information already. So social media, which is driven by emotions, is actually influencing very much short-sighted decision making. So Russian propaganda is actually taking very different forms. It's not, that straight as we would assume it was like 30, 40, 50 years ago. It takes very, very different forms. And we are still in the reactive form. That's what saddens me. I've been talking about this years ago to many of my international European colleagues, saying we have to think outside the box. In order to counter Russian propaganda, we have to imagine unimaginable, because they are not driven by logic. They are not driven by rules, by procedures. So
you're frozen on my screen. Oh, no, you're back.
Am I?
No, you're.
So
please repeat the last sentence or the last two sentences.
Okay. We are still in the reactive format. In order to be able to counter Russian propaganda, we have to really think unimaginable things, think stupid things, and then only we will be able to be a couple of steps ahead of Russian Federation, and not to be reactive, but actually to be proactive together in encountering different challenges and threats that are coming from the Russian Federation, including the propaganda challenge.
Thank you for these remarks. Understood. Another call for more proactiveness. Victoria, before I give you the floor to, well, first of all, I saw you reacting to what Mrs. Klympush-Tsintsadze said, and to focus on the trust issue, especially regarding a vaccination rollout. I would love to have your opinion there. I also see the first questions come.
So it was meant.
Yes, Miriam.
In the chat function, and then Silke will come in with questions, with other questions on Facebook. Before Victoria has the floor, the question coming from Alexander Markus of the Chamber of Commerce, the German Business Association in Ukraine. He says he heard many times during the last months that Ukraine will turn to other countries, for example, China, if the EU will not become more supportive and flexible. for example, coming to negotiating agricultural quotas on Ukrainian products. How realistic is such a scenario in reality, or is it just a threat without any realistic foundation? While you can ponder on that question, Victoria, you have the floor.
Yes, thank you. Thank you very much. And indeed, it's hard to add something to such prominent speakers as Mr. Nouripour and Ms. Ivanna Klimpostenzatze. But I think speaking about the trust, overall, people, patients, despite the disinformation that is pouring, still trust doctors in terms of their decision-making with regards to vaccination. They do receive their information from Facebook and other social media. They do get affected by this communication, and that is adding to the mistrust that is already there. And absolutely, as Ivana said, it is fueled by Russian propaganda and channeled through open or closed groups, targeted groups that are, you know, either moms groups or professional groups. So one mistrust comes from there. Another part indeed comes from impact that they do have on professional community and health professionals, meaning doctors and nurses. We observe in our circles that there's still a portion of doctors in Ukraine who refer to Russian medical schools and who believe that they are providing, you know, adequate knowledge, provide adequate examples, and therefore it is always a risk that they, you know, through these individuals, through these associations, are channel their misinformation and spread the mistrust that is already there. And then I think the sanctions on media and closure of certain channels is a contribution to clean the informational space with regards to trusted information, with the decisions that are based on the evidence and medical facts, but not manipulations or preserved, I don't know, efficiency or perceived fashion. So I think that's the answer, because these mis and disinformation come from two sources, meaning two channels. Rather, one channel is just, you know, social media, public accounts, etc. Another is from professional channels, because there is still a lot of links that I think needs to be reduced.
Maybe for those not so familiar with Ukraine, lately certain media was closed down in Ukraine to counteract propaganda. Mrs. Klympush-Tsintsadze, Mr. Nouripour, the question about agricultural quotas. Who would like to go first? Ivana.
Yeah, let me come in. Well, we in order to understand where come our agricultural quotas, where from they come, actually after the start of the Russian-Ukrainian war, there was a long discussed but then taken additional decision by the European Union when the EU has come out for 3 years with additional quotas, agricultural quotas for Ukraine, for this kind of specific term. Obviously, the situation is changing, and obviously Ukraine is also growing in some sectors of economy, and agriculture for us is very, very important. So definitely, it's extremely important to have a productive and constructive dialogue, and not restrictive dialogue with the EU if we are talking about the longer term perspective of Ukraine actually joining the EU and becoming part of the union. However, if we are talking, if we are considering the possibility of having Ukraine turning towards towards China, as the question was posed in agricultural cooperation. First, the EU association agreement does not preclude Ukraine from having trade with China, specifically in agricultural sphere. I think that this shouldn't be here, this particular case, where we should not say either or. That's one thing. But when we have to also understand that, unfortunately, Ukraine today is governed by a lot of emotional and populistic decisions, as opposed to institutional and policy analysis based decisions, and therefore we can hear such such statements or such I've lost the English words, chantage, how do you say this?
Blackmail.
Blackmail, yeah, thank you. Blackmailing of the EU. I categorically do not share such an approach, because that reminds me of something that has been happening over the last couple of months, when suddenly from the Ukrainian authorities we've heard categorical insistence that we need all the perspectives of the memberships right now. Doesn't matter whether we do reforms or we don't do the reforms. I belong to those who understand that in order to be compatible with any countries of any union, we actually have to prepare ourselves in order to strongly come in as an equal partner, even to the European Union or into NATO. So yes, you can hear such voices in Ukraine. Yes, unfortunately, some of the I would say not adult politicians are trying to blackmail our democratic partners with such an approach. But I think that even the weakest institutions we have will, and those safe locks that we put in our constitution, for example, with the strategic goals of joining the EU and NATO, they should actually preclude this moving to different directions, strategically moving to different directions. Mm-hmm.
Thank you. Mr. Nouripour, anything you would like to add regarding the EU quotas?
No, but I want to. I did the question of the Sino-Ukrainian relationship, which I think was the headline of the question. But by the way, let me refer to one single issue Ivana just mentioned before. Of course, Ukraine is not the only country which is affected by the fake news and misinformation and campaigns of the Kremlin. But just one example. There had been a recent book publication in Germany, Russia Today, Inside Russia Today, has been written by a journalist who worked there before and then quit. And this book is not accessible in Germany anymore because of the huge copyright contest which has been started. And this is amazing, and this is crazy, and I think we can learn a lot from you in Ukraine, because you are the front line and you are affected the most and first. To be honest, the answer to the question is the question of the Sino-Ukrainian relationship is a question of it's belong to the Ukrainian people, and the entire revolution of dignity is supported by us and it's supported by so many people in Ukraine, because it's about Ukrainian people deciding which are their alliances and which relationship they want to have, and it's not about Berlin or Moscow to decide that. But of course, I would give some advices which are the boundaries of a deep friendship with China, and I think our friends in Ukraine know them very, very well. But after all of this discussion we had on lack of support from the European side, it's my duty as not as an MP, but as a friend of Ukraine to mention that there are also spoilers on the other side. And of course, it's some kind of complicated to keep up the solidarity of our people when it comes to the reforms, especially in the fight against corruption in Ukraine. And just one example, and Ivana and I know that we're sharing that view. You know, the judgment of the Constitutional Court that when it came to NABU was not the biggest help for us to convince our people to keep up solidarity with Ukraine. So we have to help, but I know that my Ukrainian friends also know that there are a couple of boxes on their side they still have to check.
Thank you, Mr. Nouripour. Thank you also, Ms. Klympush-Tsintsadze, for clarifying the difference that Ukraine has a certain amount of flexibility because a DCFTA, a free trade agreement, is not a customs union. And therefore, I'm just mentioning this because often in Europe, in Germany, people still believe that it was an either or, which is not the case and which has never been the case. Silke, finally, I would like to give to hand over to you for further questions from the audience.
Mm-hmm. Thank you, Miriam. Can you hear me? Yes.
Yes.
Yeah. Thank you to all our speakers for these interesting discussions. I just want to say that we have right now around 30 people following us live on Zoom and Facebook. And I received just a few questions, and I want to bring in two of them. The first question goes to all speakers. Ms. Klympush has mentioned the inclusiveness of the world and how it is challenged by plans in the European Union for the green pass in order to simplify traveling inside the EU for vaccinated people. So how would it be possible to get Ukraine involved in these plans, and how to deal in that case with vaccinations which are not certified in the European Union? We mentioned them before. And so this is the first question, and the second question gets us back to the beginning of our discussion. Ms. Tymoshevska mentioned that there's too little testing and the slow rollout of vaccination as major problems right now in Ukraine to fight the pandemic. So how could this be improved, and how could the international community help even better? And are there any concrete initiatives of support which we should know about? This is the second question. Thank you very much.
Thank you, Silke. And may I add a question to Victoria? Do we have any insights into the COVID situation in the occupied territories? I read or heard that particularly hospitals and prisons are worrisome. When you respond to the other question, maybe you could also add a couple of insights there. Thank you. Ivana and then Victoria.
Well, I guess there is no answer to my to the first question, because that's probably something that maybe Omid could respond to. How can we include Ukraine into into the development of the new reality, or the updated reality in the pandemic, in the after pandemic world. I think it's not only how we can include Ukraine, but also how can we include other countries that do have that have started using already some of the freedoms that the EU citizens also use. And I think that was such a great and important achievement when the visa-free was given to Ukrainians, to Georgians, to Moldovans. You know, it wasn't because we were beautiful or nice, or we have gone through a number of revolutions, or that we have suffered from the Russian aggression, but that was because we did our difficult and important homework. So I think if right now, when the rules are being kind of laid out, I think it's about laying out those rules with the partners together, maybe engaging partners at this particular moment in thinking through how the procedures could be open to others as well. And I think that this is not happening at all. And this is what is missing right now. I think once you have the sincere and open dialogue, not one-sided dialogue, not radio type dialogue when you are speaking, and someone on the other side is only receiving, but actually hearing and responding to each other, then we will have the possibility to actually come up with better solutions. That's the same thing as in gender equality. You know, when you include people of both genders into decision making, then you have a much more stable decision and long-lasting decision. That's again, when you include wider number of partners in coming up with the solution or the blueprint for the solution, I think then you'll have a much more inclusive and actually much more receptive decision as well.
Thank you. Victoria,
Yes,
about the rollout and the occupied territories.
Yes, I think starting from the first and going further, with regards to vaccination, one of the specific example is the fact that if we are looking into COVAX as an opportunity to cover 20% of the priority groups identified with vaccines, that would account for about 9.6 million doses of vaccines that are needed. And as I'm looking at current COVAX interim distribution forecast, the latest available on the website, it states that Ukraine is to expect 2.2 million doses of vaccines. So my concern is, of course, and request or kind ask would be to make sure that indeed this interim forecast is updated and there are specific numbers and specific vaccines that listed for Ukraine, so that we indeed can expect covering this 9.6 million doses from COVAX facility. Speaking about testing, indeed, I strongly believe that the private sector facilities and capacities should be properly utilized, and these waste of or inequality created by out-of-pocket payments should be counterbalanced by an opportunity to get reimbursed for testing when is ordered by a physician or a health provider through public funding. And indeed, we do have the National Health Service of Ukraine who can develop procedures, and it is more a matter of a budget allocations and rather than a technology that can be backed up to ensure the accountability of these funds are spent. But again, utilizing private sector to cover insufficiency of the public laboratory system, I think is one of the strong and reasonable options. Speaking about the situation in occupied territories, indeed, the data is very scarce. From our colleagues, we hear that similarly to Ukraine, palliative care services are often used to cover up for the health services that are not offered to patients. Chronically ill patients or patients in terminal conditions are often denied care, as seen non-prospective patients with limited access to, again, early testing and early response to worsening of patients' conditions and need for critical care. Again, with the cities or villages that are closer to gray zone or borderline zone where there is an unstable electricity supply, there are cases where, you know, patients are lost due to the uninterrupted vital supplies in these hospitals. With regards to prison, we do have civil society organizations who used to support different projects in prisons, and indeed, their often cases are hidden. There is often no options for isolation or immediate cure, and therefore
Victoria, I don't want to cut you short, and I'll give you the floor back immediately. I just received a message that Mr. Nouripour has to leave in 3 minutes. So I would like to give him the opportunity for his final remarks on on whatever you would like to, from your heart, add to this debate today. And then you may go to your next country today.
Thank you. From the deep of my heart, first, I apologize to Victoria that she's been interrupted because of mine, and second, I deeply miss Ukraine. I hope to be there very soon. There are some secret plans for a trip. I hope that we can accomplish. I'm super grateful for being part of this, and just want to thank to our great moderator, and especially to the Kiev Dialogue for setting up this great panel, because it's highly important to go on talking about our relationship, about how we can stand together and how we can support each other and we can learn from each other, especially in these days, especially after that what we saw for the last week, coming from Russia to the eastern part of Ukraine. It's highly important to go on with the dialogue. Thank you very much for it.
Thank you very much for your time. Bye-bye. And Victoria, back to you.
So speaking back, indeed, the prison situation is also dire because there is it's the places of confinement and no opportunities or options for isolation or quick access to care. And since the prison population globally are strongly hit by tuberculosis and HIV pandemic, we see the comorbidities that have there, and general lack of access to health services contributes to higher dissemination rates and higher morbidity. But again, we don't have access to official numbers, and unofficial are very hard to keep because of very, spotted or mosaic information that comes from different sources and often shared on anonymous basis because of the fear of being persecuted or not allowed to provide some of the services that civil society organizations are trying to provide as a humanitarian assistance. Thank you.
Thank you, Victoria. Ivana, maybe asking you to give a short and concise answer. I was wondering whether you could comment on to which extent the access of the monitoring mission has been somehow hindered by the pandemic.
Just briefly, we have another pandemic that is not allowing the OSCE mission to actually go to the occupied territory, and that's exactly the Russian Federation and its and the puppets of the Russian Federation that are serving there. So therefore, access of the OSCE monitoring mission has been difficult to the occupied territories, and that's not a secret. Right now, unfortunately, even the quite frequently some of the humanitarian organizations attempts to bring in the first needed protection, for example, materials or disinfections or whatever, or masks, that is also becoming pretty difficult in some cases. So unfortunately, what we hear that sometimes even the international humanitarian organizations have difficulty with accessing people in the occupied territories and helping them in the dire need.
Thank you. Silke, if you don't have further questions, I would close the panel. I'd like to conclude that there is tremendous EU support and sympathy toward Ukraine, but a coherent strategic policy is still lacking in light of the current additional challenge. As Mr. Nouripour has pointed out, the Ukrainian side also leaves something to be desired in terms of reform successes, rule of law, the recent constitutional court problems were brought up, corruption. But still, relations are good. One observer called it, and that's why I quote it because I liked it, critical empathy. It is an open question how this can be channeled into real more developments that the Ukrainian people clearly deserve to move forward, and thereby to ensure that they do not lose their dynamism that is so important, particularly if we look at the fact that after such a pandemic, you all mentioned the economic devastations is needed to move the country forward. I'm sure we'll be puzzling about this further in some other panel or hopefully personal meeting after the summer, all being vaccinated. And now I pass the floor. Well, I thank you all very much for your time, for your participation, for your insights. And now I pass the floor to Silke.
Thank you, Victoria Tymoshevska. Thank you, Ivana Klympush-Tsintsadze, and also, although he already left us, thanks to Omid Nouripour for your very interesting input, for your comments on the current situation. I think, yeah, we managed to speak about all the challenges, but also there's, yeah, I believe there's hope, especially with this common will to more cooperation and more mutual support also in the next months, and to overcome this pandemic together and also its side effects. So I also want to thank to you, Miriam, Kosmehl, for your excellent moderation. We faced some technical problems, but I believe we managed to understand each other very well despite those. And also thanks to our audience who followed us on Facebook and in Zoom. We will be happy to see you again at our next discussions from Kiev Dialogue. Thank you very much.
Thank you all.
Goodbye. Have a nice day.
Goodbye.